All right, hey guys, I was asked to do a sample head to toe for the validations tomorrow. And I'll kind of give it a I'll do it roughly how I would do it for the validations. I have some of the worst things I've ever drawn listed on the trifold for health promotion, but we'll make it work. Okay. So just gonna run through it real quick. You come in, you sanitize, and you say, "Hello, my name is Joan Artates. I'm a nursing student at Adventist Health University. Today I'll be performing a cardiac, pulmonary, abdominal, and neurovascular assessment on you today, as well as checking your vital signs. Is that okay?" And they say yes. Excellent. Can I have your name and date of birth, please? You check your name tag, make sure the name and date of birth is correct. And thank you. So before we begin, I'm going to ask a couple of questions to help guide my assessment of you today. So for your heart and lungs, do you have any history of cardiac issues that you are aware of? Do you have any chest pain, any difficulty breathing, any recent cough? Are you a smoker? For your abdomen, do you have any abdominal pain, any nausea, vomiting, any problems with your bowel movements? How's your diet? Do you eat a lot of fatty foods? Do you have a history of heartburn or reflux disease? Okay. For your arms and legs, do you have any pain anywhere? Any swelling of your arms, of your legs? Do you play any sports? Any injuries in the past? Do you have any difficulty with sensation? Do you have any numbness or tingling of your extremities at all? Any problems with weakness of your arms or legs? Okay. Excellent. So, with that said, I'm going to start my assessment. You are in no acute distress. You are well appearing, responding appropriately, alert. Your respirations are unlabored. And with that, I'm going to take your vital signs now, with the exception of your blood pressure. Starting with your your oxygen saturation, and you put the O2 sat, the pulse ox on them. Okay. And I will be taking your temperature. Before you take the temperature, be sure to ask, have you had anything to eat or drink in the past 15 minutes? If they're a smoker, you can also add on, have you smoked in the last 15 minutes as well? And then take their temp. I'll put this probe under your tongue. Hold it there for a few seconds, please. Okay, excellent. And then I'll be checking your heart rates and respiratory rate as well. So take their pulse, palpate the radial pulse for 30 seconds. And count. Make sure that you get to a good point in your stopwatch that you can keep an accurate count. And then for the other 30 seconds, you're going to be looking at your patient's chest and counting each rise and fall as one breath. Okay. Excellent. So your pulse is 70 beats per minute, and your respiratory rate is 14 breaths per minute, which are both within the normal range. Now, I will be assessing your neck. Could you please remind me, do you have any pain in your neck? Good. And inspection, always inspection first. Inspection of the neck skin is intact, no discoloration, no deformities. Could you please look to your left? And then look to your right. Good, no jugular vein distension. Now I'll be palpating your carotid artery in your neck. And remember, one at a time. Palpate the carotid. Good. And then please look to your other side. Palpate the other carotid. Okay. Carotid pulses are 2+ bilaterally, regular rhythm. And now I'll be auscultating to your carotid artery. And as I auscultate, I'll remind you, but please hold your breath just for a few seconds, and then I'll tell you to breathe. Okay, so stethoscope, it's in my room, but you would hold the bell to the carotid. You would say, please hold your breath, listen. Okay, good, and then breathe, thank you. And then again, for the other side, hold your breath, please, listen, and then breathe. So no carotid bruise. Okay. Now I'll be inspecting be examining your chest. And at this point, you would have the patient please remove your gown and give them a second to remove their gown. And then, again, you always start with inspection. So anterior chest first. So skin is dry, intact, no discoloration. I see no obvious deformities. Chest wall is symmetric. And you would look at their front chest and also from the side, and you would look for the anterior, posterior to transverse ratio. Should be 1 to 2. The inspection is done. Now palpation. So as you're palpating, you would ask, and I'm going to be touching your chest, and you palpate, ask for any pain, tenderness. If you want to do skin turgor, you would pinch below the clavicle. Good skin turgor. And as you're palpating, you can also palpate the mitral, the apical pulse, where the mitral valve would be auscultated. So you would say, I'm going to palpate your apical pulse now. And it'd be 5th intercostal space, mid-clavicular line, right around here. Palpate. And the textbook says 30 seconds, so maybe you can say, okay, 30 seconds have passed. Apical pulse is regular rate and rhythm. Okay, once palpation is done, auscultation. So thank you. Now I'm going to be listening to your heart. I'll be checking for a few valves along the chest wall. And I'll be listening to your heart sounds twice. Once with the diaphragm of my stethoscope, and then a second round with the bell. Just again, checking for any abnormal heart sounds or murmurs. Starting with the apical pulse, so a 2nd intercostal space at the right sternal border. Listen, so aortic valve, and then left side, pulmonic valve. 4th ICS, tricuspid valve, and then here, where you palpated the apical pulse, mitral valve. Okay, and then again, I'm going to listen with the bell this time, just breathe normally. Apical, 2nd, pulmonic, 2nd, tricuspid, 4th, and mitral valve. And once you're done auscultating, you would verbalize heart is regular, rate, and rhythm. I call it triple R, with no abnormal heart sounds or murmurs noted. Okay. And now you auscultate the lung sound. So you would say, okay, the heart exam is done. Now I'll be listening to your lungs. As I listen to your lungs, please take a deep breath in and out for me. So switch back to your diaphragm, and then you listen to 5 spots on the anterior chest. I'll be listening to 5 spots. And you start the exam. So trachea, take a deep breath in and out. Okay. And the above the clavicles, so the apices of the lungs. Again, deep breath in and out, please. And out, and then, and out. And just somewhere along the sternum for the last 2 spots. In and out. In and out. Good. So you would verbalize, lungs are clear to auscultation bilaterally, no adventitious breath sounds. Okay. Now heart and lungs are finished. The anterior chest wall exam is done. Now you would make your way to the other side of the bed and examine the patient's back. I'll use the same image for the back exam. And again, say, On inspection, back appears symmetric, no obvious deformities. Skin is intact, no discoloration, no lesions. And then inspection to palpation. So I'll be touching your back. Is that okay? And then you feel the back. Any pain as I feel your back? No tenderness? Good. So, no tenderness noted, no masses. And then auscultation. So I'll be listening to the lungs from the back this time, as well as on your right chest wall. Again, as you feel the stethoscope touch your skin, just take a deep breath in and out for me. So you check 6 spots in the back and then 1 spot on the side, the right middle lobe here. So in and out, 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 in and out. You want to go between, I know the sternum is here, but this would be the spine and the scapula. You want to pick spots in between the spine and scapula. 1, 2, 3, 4, 5, 6. And then please raise your right arm for me, sir. And you listen to the right middle lobe as well. In and out. And then percussion. I'm going to percuss here. So now I'll be tapping on your back. Just please breathe normally. Tap. 1, 2, 3, 4, 5, 6. And again, right chest wall. Tap there. So resonance heard throughout posterior chest wall. Now I'll be testing tactile fremitus. So as you feel my hands touch your back, please repeat 99. And this should be with 2 hands, but 99, 99, 99. So tactile fremitus equal throughout posterior chest wall. And now you have the symmetric expansion. You would have your hands butterfly like this. The other hand would mirror that. And you have your patient take a deep breath in, and then back out. And you would verbalize posterior chest wall with symmetric expansion upon deep inhalation. Okay. And that's it for the lung exam. So thank you. And now I'm going to examine your abdomen. Please lay flat on your back and try your best to stay as relaxed as you can. So they're going to lay supine, shirt is still off, gown is still off. And then inspection, always first. So abdomen is flat, non-distended. You can even go from the side. It's literally flat. Non-distended, no discoloration, no lesions. And now auscultation first for the abdomen before palpation. So I'll be listening to your abdomen now. Right lower quadrant. Okay, listen. Right upper, left lower. Lung sounds, bowel sounds are heard in all 4 quadrants. If I did not hear a bowel sound, I would have listened for 5 full minutes just to confirm. Okay, now comes the percussion or palpation. You get to pick. I'll do percussion first. Just tap. Right lower quadrant, left lower. Tympany heard throughout abdomen. And then palpation with 1 hand. Palpate, go a couple centimeters deep. Feel a couple spots in each quadrant. So right lower quadrant, left lower. Abdomen is non-tender, no masses felt, and the liver and the spleen were non-palpable. Okay, thank you. So abdominal exam is done. Now arms and legs. So arms. You could repeat your question. So again, do you have any swelling of your arms that you've noticed? Any pain? Do you play sports? Any old injuries? And then inspection. So skin is intact, no discoloration, no lesions. You can have your patient have their palms face down to inspect their nails. So nails are hygienic, no lesions, no signs of clubbing. And then palpation, you would palpate, okay, any pain, any tenderness. Good. Skin is warm, dry. No obvious masses or deformities, no swelling. And now I'll be palpating your pulses. So I'm going to start with your brachial pulse. Maybe with both hands at the same time, but palpate. So brachial pulses are 2+ bilaterally, regular rhythm. And then radial pulse, 2+ bilaterally, regular rhythm. And then you can check cap refill. So have your patient's hands palms face down, pinch, put pressure on a fingernail, and release. Cap refill less than 3 seconds. Okay. Now after the vascular assessment, you go to your neuro assessment. So then you put your arms up. Okay, could you please push against my arms and pull? Squeeze my hands. So they squeeze. So elbow and hand strength, 5 out of 5 bilaterally, equal. And then you test your sharp and dull sensation. So with their eyes open, I'm gonna demonstrate what sharp and what dull both feel like to the patient so that they know what to expect, and then have them close their eyes. And then you just check, okay, sharp, dull, and the other arm, dull, sharp. So any combination of that should be good. So now we've finished the upper extremity exam. Now the leg exam. And again, you can always repeat your subjective questions. Any swelling of your legs that you've noticed, any pain anywhere, you have a history of edema, and inspection. So the skin is intact, no deformities, no swelling, no lesions, no sign of any varicosities like swollen veins. Okay. And remember to ask your patient to remove their, if they haven't already, any socks, have their pant leg up so you can expose at least the lower leg. Okay, inspection. Now palpation, any pain, any tenderness. Good. So no tenderness, no obvious swelling. You can press, no pitting edema. Actually, this might be pitting edema on the cardboard, but okay. Now assess their pulses. So I'll be checking your posterior tibial and dorsalis pedis pulses. So PT pulse would be at the ankle, the medial aspect on the middle. So you feel both. You kind of go around and feel like this with both hands like that. So PT pulses are 2+ bilaterally, and then dorsalis pedis pulses, 2+ bilaterally. Excellent. You can check cap refill again. The pressure, cap refill, less than 3 seconds. Okay. After vascular comes the neuro exam. Okay, with your feet, please push down on my feet like a gas pedal. So they would push down. And then you can put your hands above their feet and say, now push up against my hands. So they would push their feet up. This would be plantar flexion and then dorsiflexion. And then once they're done with that, foot strength is 5 out of 5 bilaterally, equal. And then same thing, now check sensation, demonstrate what sharp and what dull feel like, and have your patient close their eyes. Sharp, dull, sharp, dull. Okay. And that's it. So you thank your patient. Thank you for letting me examine you. And please have a good day. And that's all I got, guys. Hopefully this helped. I didn't cover everything. I know I missed a couple of small things, but it should be enough to get through validation. So good luck, y'all.